Hi all, welcome to Fast Coder 21 Medical Coding YouTube channel. As based on subscribers' request, we have started ICD-10 CM 2023 chapter series. Today we are going to learn chapter 7 and chapter 8, which are eye and adnexa and ear. If you would like to watch chapter 1, 2, 3, 4, 5, 6, just you can search the playlist in Fast Coder 21 YouTube channel, which is mentioned as ICD-10 CM. In chapter 7, disease of the eye and adnexa, we don't have any very complex guidelines. We have more guidelines related to only glaucoma. So before going to learn about guidelines of eye and adnexa, we need to know the term glaucoma, what is glaucoma, and what are the types of glaucoma, and what are the stages of glaucoma, and how do we code glaucoma in ICD-10 CM. So what is glaucoma? So glaucoma is a disorder in which increasing pressure in the eyeball damages the optic nerve and causes loss of vision. So the reason for glaucoma is intraocular pressure. When there is a high pressure in the eye, which will damage the eyeball and also the optic nerve, which causes loss of vision. So what is open angle glaucoma? If the outflow channels are open, the disorder is called as open angle glaucoma. Next one, what is closed angle glaucoma? If the iris blocks the channels, the disorder is called closed angle glaucoma. Next, we will learn about the stages of glaucoma, which are more essential while coding glaucoma in ICD-10 CM. So first we have mild stage. So what is mild stage and what is included is evidence of changes in the aqueous outflow system of the eye. And what about moderate stage? Moderate stage is elevated intraocular pressure. What is severe stage? Atrophy of the optic nerve and loss of the visual field. What is indeterminate stage? For unusual circumstances, when the physician documented being unable to determine the stage, this is not the same as unspecified. So basically, indeterminate stage as well as unspecified stage, both are different. Why means in indeterminate stage, physician is unable to determine the stage. But in unspecified stage, we don't have any documentation to support coding the stage of glaucoma. So basically, stage unspecified is related to the documentation issue, not related to the physician. So if the physician is unable to determine the stage, we will make it as indeterminate stage. If the documentation is insufficient to code stage of the glaucoma, we can code it as unspecified stage, which will use 0 for unspecified character. So for mild stage, we will use 1. If moderate stage, we will use 2. If severe stage, we will use 3. And indeterminate stage, we will use 4th character. 4 character. So if you check H40.2231, here the answer is both eyes are mild stage. So here mild stage is number 1. So here our 7th character is number 1, as patient has mild stage glaucoma. Next, our first guideline is assigning glaucoma codes. Assign as many codes from category H40 glaucoma as needed to identify the type of glaucoma, the affected eye, and the glaucoma stage. So whenever we are coding glaucoma, we need to check 3 constants vigilantly. So one is what is the type of glaucoma, and second one is the affected eye, which will use Like we will usually call it as laterality, and the third one is the glaucoma stage. So which is stage unspecified, whether it is mild stage or moderate stage or severe stage or intermediate stage. So we need to remember three keywords to code glaucoma. So first one is type of glaucoma, second one is the affected eye, and third one is the glaucoma stage. So second guideline, bilateral glaucoma with same type and stage. So when a patient has bilateral glaucoma and both eyes are documented as being the same type and same stage, and there is a code for bilateral glaucoma, report only the code for the type of glaucoma bilateral with the seventh character for the stage. As we initially learned, we will use seventh character for glaucoma stage. So here we have an example. So Pat presents to ophthalmologist office and is diagnosed with bilateral chronic angle closure glaucoma. Both eyes are mild stage. As patient has same type and same stage of glaucoma on both eyes, we need to code only one code, and also here seventh character denotes stage of the glaucoma. So next guideline, when a patient has bilateral glaucoma and both eyes are documented as being the same type and stage, and the classification does not provide a code for bilateral glaucoma, report only one code for the type of glaucoma with the appropriate seventh character for the stage. So in this scenario, we have code for bilateral glaucoma and we have used only single code. For example, if you take H40.10 and H40.20 series, you will not find the laterality of the glaucoma or eye. Here we need to code only one code. So if you check the H40.10 series, classification did not provide the laterality of the eye in order to code laterality of the glaucomas. So what happens here? We will code only type of glaucoma as well as the stage. So here we will not code laterality of the eye. So overall, in this guideline, using this guideline, we will code only one code for the glaucoma. Next guideline number 3, bilateral glaucoma stage with different types or stages. So when a patient has bilateral glaucoma and each eye is documented as having different type or stage, and the classification distinguishes laterality, assign the appropriate code for each eye rather than the code for bilateral glaucoma. So if the patient has different type or stage on the different eyes, like right eye some different type and left eye different type, and the classification has the laterality code, we need to code two codes in order to code this glaucoma. So basically, if we have different type or different stage, we need to code two codes. If we don't have different type or stage, we need to code single code. So we have an example here. Patricia presents to ophthalmologist office with bilateral acute angle closure glaucoma, right eye with moderate stage and left eye with severe stage. So here stages are different. So we need to code two codes, H40 2112 as well as H40 2123. So we need to code for like moderate stage as well as the severe stage. So we have one more guideline. When a patient has bilateral glaucoma and each eye is documented as having different type and the classification does not distinguish laterality, assign one code for each type of glaucoma with the appropriate seventh character for the same stage. Next guideline. When a patient has bilateral glaucoma and each eye is documented as having same type but different stage and the classification does not distinguish laterality, assign a code for the type of glaucoma for each eye with the seventh character for specific glaucoma stage documented for each eye. So we need to check if we have same type and same stage, we can code bilateral code. So if we don't have bilateral code, we need to assign unilateral code like right and right, sorry, left and right using the stage. Next guideline is patient admitted with glaucoma and stage evolves during the admission. So if a patient is admitted with glaucoma and the stage progresses during the admission, assign the code for highest stage documented. So we need to check. So if, for example, if the patients admit with mild stage and it leads to severe stage, we need to code only severe stage glaucoma, not mild stage, as mild stage is at the time of the admission and it becomes severe after the admission. So we need to code highest stage. So which is severe stage. So next guideline, indeterminate stage glaucoma. So assignment of seventh character 4 for indeterminate stage should be based on the clinical documentation. The seventh character 4 is used for glaucomas whose stage cannot be clinically determined. This seventh character should not be confused with the seventh character 0 unspecified, which should be assigned when there is no documentation regarding the stage of the glaucoma. So we have an example here. Regalia has not yet completed the visual field, but has open angle glaucoma with borderline findings would be coded to H40.011 times 4 or 2 times 4, or if both eyes are impacted, the code would be H40.013 times 4. So here what happened? So we need to understand what is indeterminate stage and unspecified stage. So if the patient or the physician is unable to define the stage of the glaucoma, we need to use seventh character as 4, which we will use it for indeterminate stage. And if the documentation does not provide the stage of the glaucoma, we need to use seventh character as 0. So basically indeterminate stage is mentioned by the physician, and this unspecified stage, whenever we don't have stage in the document, we need to code seventh character 0 in order to code unspecified stage glaucoma. Next, blindness. So if blindness or low vision of both eyes is documented, but the visual impairment category is not documented, assign code H54.3 unqualified visual loss both eyes. If blindness or low vision on the eye is documented, but the visual impairment category is not documented, assign a code from H54.6 unqualified visual loss one eye. If blindness or visual loss is documented without any information about whether one or both eyes are affected, assign code H54.7 unspecified visual loss. Guys, as we all of us know, chapter 8, this is the year and mastered process. We don't have any guidelines as per our CMS guidelines. It is reserved for future guideline expansion. Guys, we hope you understand this session, which is a very small session, but it is a little bit confusing. So while you watching this video, try to use the examples provided in this document or this session. And also, if you have any comments, please mention in the comment section. Please like, share, subscribe to FastCoder 21 Medical Coding YouTube channel.